Would you be willing to go back to this? What would it take for you to mask up again?
Mask mandates are coming back to schools?
How did I not know this? There is a law that has been passed.
Oh my God, is it true that there's going to be new mask mandates again for 23 into 24? There's so much media hype right now and so much misinformation on the internet that I think it's important that a medical expert give an opinion and try to explain exactly what's going on right now in the country. Hi, I'm Dr. Messina, and I was fellowship trained in critical care medicine. Basically, the concern is that we've had a steady uptick in new COVID cases since early July, going right up until now, early September. We've had approximately a 20% rise in caseload just in the last few weeks, and approximately 15,000 admissions to the hospital across the country per day. But there's some interesting news about that that's really good news. First of all, those admissions to the hospital, very few are landing in the ICU. Very few are requiring mechanical ventilation, so that's good. That means that the virus is not nearly as potent or virulent as the earlier strains were. Now, this virus that's circulating right now, I'm not going to get involved in giving you the names and the numbers. We're just going to talk about the virus that's here September 2023. It started out as an Omicron virus. However, it mutated, and it mutated so severely that there's a concern that it might elude our immune system. So if you developed an immunity to this viral disease, either by having the virus or getting inoculated with the vaccine, there's a potential that this new virus could infect you. However, on the good side, it seems to be a significantly less potent virus, giving a milder viral illness. Most patients have been experiencing congestion, headache, and a very bad sore throat. Others fatigue, malaise, and a fever, while others have started out with digestive changes such as diarrhea or gastric pain, followed by some fatigue and a sore throat. So that's a good thing, that it seems to be significantly less virulent than the previous strains. The other thing is, we have an uptick right now between August and September. But guess what? We had an uptick last year as well. And as a matter of fact, this year's uptick so far hasn't been as rapid and as high as last year's uptick. The only difference is that this is a much more mutated strain than last year, so it's leading to some concern. Now, it is true that some universities and elementary schools have mandated the masks, but that did not come from any government or medical agency. That's their own doing. That's their own precaution. Now, I discussed this with my own Department of Health and looking at what the CDC literature is showing. And nobody is saying that mask mandates are in the near future. I personally can't see it happening unless a very specific thing occurs. Unless this virus becomes so potent that we run the potential of overwhelming the hospitals and the medical system again, as had happened in 2020, I can't see mask mandates taking effect. People will say, well, why are we thinking of mask mandating now? Well, we're actually not. They're recommending that if you are in a situation such as a train that's packed with people or an airplane packed with people, that maybe you should be a little cautious, especially if you have risk factors. People say, well, why don't we do this for the flu? The reason why, although the symptoms are very close, this is not a flu. The flu never overwhelms our medical system. The other reason that we're not as concerned about mask mandates these days is because in the last 3 years, we learned a lot about this virus. And we have vaccines that are very effective. In fact, Moderna just came out and said its bivalent vaccine gives you protection for this virus that's circulating right now, September 2023. So that's good. But we also have antivirals. Paxlovid can prevent you from progressing to severe disease. We didn't have that in 2020. And we had sick people overwhelming the hospital system, sick people overwhelming the intensive care units, and staff getting sick. We don't have any of that right now. So no, I wouldn't be concerned that there's going to be any type of mask mandate in the near future. Just be cautious. I hope this gave you some information. I hope it gave you a little peace of mind that mask mandates are not looming in our near future. And I think we're really going to continue to be life the way it was. Take care. Have a good day.